And in this series of lectures, I will walk you through the skull. And some of the learning outcomes that you will have at the end of these groups of lectures is you will be able to identify the major skeletal landmarks of all 14 facial bones, as well as the major skeletal landmarks of all 8 cranial bones. We'll identify and list the 4 major sutures of the skull. We'll describe and locate the function of the paranasal sinuses. And finally, we'll identify the major foramina of the skull and list the structures that pass through each. In this lecture, I will provide a brief introduction into the skull. Each of the bones that I will discuss here will be discussed in more depth during their respective lecture. The skull is divided into 2 major classifications of bones. The cranial bones, or neurocranial bones, which sit largely on the superior portion, and then the facial bones of the skull, which largely rest along the face. The frontal bone, the parietal bone, the ethmoid bone, the occipital bone, the sphenoid bone, and the temporal bone all are classified as bones of the neurocranium, which means they largely are situated in place to protect the brain. While bones like the zygomatic bone, the nasal bone, the inferior nasal concha, the maxilla, the vomer, and the mandible all represent bones of the face and are largely creating the contours and shape of the human face.